Hashtag the silent killer, your complete guide to understanding and preventing coronary artery disease. Every 36 seconds, someone in the United States dies from cardiovascular disease, making it the leading cause of death for both men and women across all racial and ethnic groups. Among these devastating statistics, coronary artery disease stands as the most common and deadliest form of heart disease, silently claiming lives and destroying families while often remaining undetected until it strikes with devastating force. This comprehensive guide will arm you with the knowledge and tools necessary to understand, recognize, and most importantly, prevent this silent killer from claiming your life or the lives of your loved ones. The information contained within these pages could literally save your life, and every American should understand these critical facts about coronary artery disease. Hashtag understanding the enemy within your chest. Coronary artery disease represents a catastrophic failure of your body's most vital supply system, the network of blood vessels that feed your heart muscle with the oxygen and nutrients it desperately needs to keep you alive. When these arteries become narrowed or blocked by atherosclerotic plaques, your heart begins to starve, leading to chest pain, heart attacks, and ultimately death if left untreated. The disease manifests in two primary forms, each presenting unique dangers and requiring different approaches to recognition and treatment. Acute coronary syndrome strikes suddenly and violently, encompassing unstable angina and acute myocardial infarction, occurring when atherosclerotic plaques rupture or blood clots completely block coronary arteries. This form can kill within minutes, offering little warning and demanding immediate emergency intervention. Chronic coronary artery disease, conversely, develops insidiously over decades, progressing silently while gradually strangling your heart's blood supply. This form often goes unnoticed until significant damage has already occurred, making prevention and early detection absolutely critical for survival. The mechanism behind this killer involves the gradual accumulation of fatty substances, cholesterol, and cellular waste products within the walls of your coronary arteries. These deposits, called atherosclerotic plaques, begin forming early in life and continue growing throughout adulthood, particularly in the presence of risk factors that accelerate the process. When the inner wall of a coronary artery becomes damaged through high blood pressure, smoking, diabetes, or other factors, these fatty substances begin sticking to the damaged areas like debris collecting in a damaged pipe. Over time, these deposits harden and calcify, creating plaques that progressively narrow the arterial opening and reduce blood flow to your heart muscle. The most dangerous moment occurs when these plaques become unstable and rupture, exposing their contents to the bloodstream. When this happens, blood cells called platelets rush to the site to form a clot, potentially completely blocking the artery and causing a heart attack that can kill you within minutes. Hashtag recognizing the warning signs that could save your life. The symptoms of coronary artery disease can be subtle and easily dismissed, particularly in the early stages when intervention would be most effective. However, understanding and recognizing these warning signs could mean the difference between life and death for you or someone you love. Angina, the most common symptom of coronary artery disease, manifests as chest pain or discomfort that occurs when your heart muscle does not receive adequate blood flow. This pain typically feels like pressure, squeezing, fullness, or burning in the center of your chest, often described by patients as feeling like an elephant sitting on their chest or a tight band wrapped around their torso. The pain of angina typically occurs during physical exertion, emotional stress, or exposure to cold temperatures, when your heart demands more oxygen than the narrowed coronary arteries can provide. The discomfort usually lasts between 3 to 5 minutes and rarely persists for more than 15 minutes, subsiding when you rest or take nitroglycerin medication. Critically important to understand is that angina pain often radiates beyond the chest, spreading to your neck, jaw, shoulders, arms, or back. Many people, particularly women, experience angina primarily in these areas rather than in the classic chest location, leading to dangerous delays in seeking medical attention. If chest pain lasts longer than 15 minutes or occurs while you are at rest, you may be experiencing a heart attack and must seek immediate emergency medical care. Every minute of delay increases the amount of heart muscle that dies and reduces your chances of survival. Beyond classic angina, coronary artery disease can present with numerous other symptoms that are often overlooked or attributed to other conditions. Shortness of breath, particularly during exertion or when lying flat, may indicate that your heart cannot pump effectively due to reduced blood flow. This symptom often develops gradually and may be dismissed as normal aging or being out of shape. Dizziness or lightheadedness can occur when your heart cannot pump enough blood to meet your body's needs, potentially indicating significant coronary artery disease. Similarly, heart palpitations or irregular heartbeats may signal that your heart muscle is struggling due to inadequate blood supply. Fatigue that seems disproportionate to your activity level or that represents a significant change from your normal energy levels may indicate that your heart is working harder to pump blood through narrowed arteries. This symptom is particularly common in women and older adults and is often overlooked as a sign of heart disease. Some individuals experience no symptoms at all, a condition known as silent ischemia, where the heart muscle receives inadequate blood flow without producing pain or discomfort. This particularly dangerous form of coronary artery disease is more common in people with diabetes and older adults, making regular screening and preventive care absolutely essential. #The risk factors that determine your fate. Understanding the risk factors for coronary artery disease empowers you to take control of your cardiovascular health and potentially prevent this killer from claiming your life. These risk factors fall into two categories: those you cannot control and those you can modify through lifestyle changes and medical intervention. Uncontrollable risk factors include your age, with risk increasing significantly after age 45 for men and 55 for women. Family history plays a crucial role, with your risk substantially elevated if your father or brother developed coronary artery disease before age 55, or your mother or sister developed the condition before age 65. Your gender also influences risk, with men generally developing coronary artery disease earlier than women, although women's risk increases dramatically after menopause. Certain ethnic groups, including African Americans, Hispanic Americans, and Native Americans, face higher rates of coronary artery disease due to genetic factors and higher prevalence of risk factors. The controllable risk factors represent your opportunity to fight back against this silent killer and dramatically reduce your chances of developing coronary artery disease. High blood pressure, often called the silent killer itself, forces your heart to work harder and damages the inner walls of your arteries, creating perfect conditions for plaque formation. Diabetes significantly accelerates atherosclerosis by damaging blood vessel walls and increasing inflammation throughout your cardiovascular system. People with diabetes have 2 to 4 times higher risk of developing coronary artery disease compared to those without diabetes, making blood sugar control absolutely critical for cardiovascular health. Dyslipidemia, characterized by elevated levels of low-density lipoprotein cholesterol, low levels of high-density lipoprotein cholesterol, and elevated triglycerides, provides the raw materials for plaque formation within your arteries. Every point of elevation in your cholesterol levels increases your risk of coronary artery disease and heart attack. Smoking represents one of the most powerful and preventable risk factors for coronary artery disease, increasing your risk by 2 to 4 times compared to non-smokers. Cigarette smoke damages the inner lining of your arteries, reduces oxygen in your blood, increases blood clotting, and accelerates the formation of atherosclerotic plaques. Obesity, particularly abdominal obesity, creates a cascade of metabolic problems that dramatically increase coronary artery disease risk. Excess weight raises blood pressure, increases insulin resistance, elevates cholesterol levels, and promotes inflammation throughout your body. Physical inactivity doubles your risk of coronary artery disease by contributing to obesity, high blood pressure, diabetes, and unfavorable cholesterol levels. Regular physical activity, conversely, strengthens your heart muscle, improves circulation, and helps control multiple risk factors simultaneously. Chronic stress triggers the release of hormones that increase blood pressure, promote inflammation, and accelerate atherosclerosis. People under chronic stress often engage in unhealthy behaviors like smoking, overeating, and avoiding exercise, further compounding their cardiovascular risk. Poor dietary choices, particularly diets high in saturated fats, trans fats, cholesterol, sodium, and added sugars, while low in fruits, vegetables, and whole grains, create the perfect storm for coronary artery disease development. The standard American diet, unfortunately, promotes rather than prevents cardiovascular disease. Sleep apnea, a condition where breathing repeatedly stops and starts during sleep, increases coronary artery disease risk by causing repeated drops in blood oxygen levels, raising blood pressure, and increasing stress on the cardiovascular system. Many people with sleep apnea remain undiagnosed, allowing this risk factor to silently contribute to their cardiovascular demise. ## The devastating impact on American lives. The statistics surrounding coronary artery disease in America paint a picture of epidemic proportions that should alarm every citizen. Approximately 18 million Americans currently live with coronary artery disease, with hundreds of thousands more developing the condition each year. The economic burden exceeds $200 billion annually, including healthcare costs, lost productivity, and premature deaths. More troubling is the trend toward younger Americans developing coronary artery disease, with increasing numbers of people in their 30s and 40s suffering heart attacks and requiring invasive cardiac procedures. This shift reflects the growing prevalence of obesity, diabetes, and sedentary lifestyles among younger generations, combined with increased stress levels and poor dietary habits. Women face particular challenges with coronary artery disease, as their symptoms often differ from the classic presentation seen in men. Women are more likely to experience fatigue, nausea, back pain, and jaw pain rather than classic chest pain, leading to delayed diagnosis and treatment. This gender disparity in symptom recognition contributes to higher mortality rates among women with coronary artery disease. Racial and ethnic minorities face disproportionate impacts from coronary artery disease, with African Americans experiencing higher rates of high blood pressure, diabetes, and obesity, all of which increase coronary artery disease risk. Hispanic Americans and Native Americans also face elevated risks due to genetic factors and higher prevalence of cardiovascular risk factors. The geographic distribution of coronary artery disease in America reveals concerning patterns, with higher rates in the southeastern United States, often referred to as the stroke belt. This region's higher rates of smoking, obesity, diabetes, and poor dietary habits contribute to its elevated cardiovascular disease burden. Rural Americans face unique challenges in preventing and treating coronary artery disease, including limited access to specialized cardiac care, longer travel distances to medical facilities, and higher rates of cardiovascular risk factors. These disparities in healthcare access contribute to worse outcomes for rural residents with coronary artery disease. ## Prevention, your most powerful weapon. Prevention represents your most effective strategy for defeating coronary artery disease, offering the opportunity to avoid this killer entirely rather than fighting it after it has already invaded your arteries. The prevention approach must address all modifiable risk factors simultaneously, creating a comprehensive shield against cardiovascular disease. Blood pressure control stands as the cornerstone of coronary artery disease prevention, with target blood pressure levels below 130/80 mm of mercury for most adults. Achieving and maintaining optimal blood pressure requires a combination of lifestyle modifications and, when necessary, antihypertensive medications prescribed by your healthcare provider. Dietary modifications form the foundation of blood pressure control, with reduced sodium intake being particularly important. The average American consumes more than twice the recommended daily sodium limit, contributing to elevated blood pressure and increased coronary artery disease risk. Reducing processed food consumption, reading food labels carefully, and preparing meals at home allows you to control sodium intake effectively. Increasing potassium intake through fruits and vegetables helps counteract sodium's blood pressure-raising effects while providing additional cardiovascular benefits. Foods rich in potassium include bananas, oranges, spinach, sweet potatoes, and beans, all of which should feature prominently in a heart-healthy diet. Regular physical activity provides powerful blood pressure-lowering effects, with aerobic exercise being particularly beneficial. The American Heart Association recommends at least 150 minutes of moderate-intensity aerobic activity or 75 minutes of vigorous intensity aerobic activity per week, combined with muscle-strengthening activities at least twice weekly. Weight management plays a crucial role in blood pressure control, with even modest weight loss producing significant blood pressure reductions. Losing just 10 pounds can lower systolic blood pressure by 5 to 10 millimeters of mercury, substantially reducing coronary artery disease risk. Cholesterol management requires a comprehensive approach addressing both dietary cholesterol intake and cholesterol production within your body. Dietary modifications focus on reducing saturated fat intake, eliminating trans fats completely, and increasing consumption of foods that actively lower cholesterol levels. Soluble fiber, found in oats, beans, apples, and other fruits and vegetables, binds cholesterol in your digestive system and helps eliminate it from your body. Consuming 25 to 30 grams of fiber daily, with at least 10 grams from soluble sources, can significantly reduce cholesterol levels and coronary artery disease risk. Plant stanols and sterols, naturally occurring compounds found in small amounts in fruits, vegetables, nuts, and seeds, block cholesterol absorption in your intestines. Foods fortified with these compounds or supplements containing plant stanols and sterols can reduce cholesterol levels by 6 to 15%. Regular physical activity not only helps control weight and blood pressure but also improves cholesterol profiles by raising high-density lipoprotein cholesterol levels and reducing triglycerides. The intensity and duration of exercise both influence these beneficial effects, with more vigorous activity producing greater improvements. For individuals unable to achieve target cholesterol levels through lifestyle modifications alone, statin medications provide powerful cholesterol-lowering effects and additional cardiovascular benefits. These medications not only reduce cholesterol production but also stabilize atherosclerotic plaques, reducing the risk of plaque rupture and heart attack. Diabetes prevention and management require particular attention to diet, physical activity, and weight control. The same lifestyle modifications that prevent coronary artery disease also help prevent type 2 diabetes, creating a synergistic effect that dramatically reduces overall cardiovascular risk. Blood sugar control in people with diabetes requires regular monitoring, appropriate medication management, and lifestyle modifications. Maintaining hemoglobin A1c levels below 7% for most adults with diabetes significantly reduces cardiovascular complications, including coronary artery disease. Smoking cessation represents the single most important step smokers can take to reduce their coronary artery disease risk. The benefits of quitting smoking begin immediately, with substantial risk reduction occurring within the first year and continuing to improve over time. Nicotine replacement therapy, prescription medications, behavioral counseling, and support groups all increase the chances of successful smoking cessation. The combination of multiple approaches proves most effective, with success rates significantly higher than attempting to quit without assistance. ## Dietary strategies for heart health. Nutrition plays a fundamental role in preventing coronary artery disease, with certain dietary patterns providing powerful protection against cardiovascular disease while others significantly increase risk. Understanding and implementing heart-healthy dietary strategies can dramatically reduce your chances of developing coronary artery disease. The Mediterranean diet, extensively studied and proven to reduce coronary artery disease risk, emphasizes fruits, vegetables, whole grains, legumes, nuts, olive oil, and fish while limiting red meat, processed foods, and refined sugars. This dietary pattern provides anti-inflammatory compounds, healthy fats, and antioxidants that protect against atherosclerosis. Omega-3 fatty acids, particularly those found in fatty fish like salmon, mackerel, sardines, and tuna, provide powerful cardiovascular benefits by reducing inflammation, lowering triglycerides, and stabilizing atherosclerotic plaques. Consuming at least 2 servings of fatty fish weekly significantly reduces coronary artery disease risk. For individuals who do not consume fish regularly, omega-3 supplements derived from fish oil or algae can provide similar benefits. However, obtaining omega-3 fatty acids from whole foods provides additional nutrients and compounds that supplements cannot replicate. Antioxidant-rich foods, including berries, dark leafy greens, nuts, and colorful vegetables, help prevent the oxidation of low-density lipoprotein cholesterol, a key step in atherosclerotic plaque formation. These foods also provide anti-inflammatory compounds that protect blood vessel walls from damage. Whole grains provide soluble fiber, B vitamins, and other nutrients that support cardiovascular health while helping maintain stable blood sugar levels. Replacing refined grains with whole grains reduces coronary artery disease risk and provides sustained energy without the blood sugar spikes associated with processed carbohydrates. Limiting added sugars, particularly those found in sugar-sweetened beverages, desserts, and processed foods, helps prevent obesity, diabetes, and unfavorable changes in cholesterol levels. The American Heart Association recommends limiting added sugar intake to no more than 6 teaspoons daily for women and 9 teaspoons daily for men. Reducing sodium intake requires vigilance in reading food labels and choosing fresh, minimally processed foods whenever possible. Restaurant meals, processed foods, and canned goods often contain excessive sodium levels that can raise blood pressure and increase coronary artery disease risk. Portion control plays a crucial role in weight management and cardiovascular health, with many Americans consuming portions far exceeding their caloric needs. Learning to recognize appropriate portion sizes and using smaller plates and bowls can help control calorie intake without feeling deprived. Meal timing and frequency can influence cardiovascular risk factors, with regular meal patterns helping maintain stable blood sugar levels and preventing overeating. Skipping meals, particularly breakfast, can lead to poor food choices and excessive calorie consumption later in the day. Hydration also affects cardiovascular health, with adequate water intake supporting circulation and helping maintain healthy blood pressure levels. Replacing sugar-sweetened beverages with water provides cardiovascular benefits while reducing calorie intake. #exercise, your heart's best friend. Regular physical activity provides some of the most powerful protection against coronary artery disease available, with effects that extend far beyond simple weight control. Exercise strengthens your heart muscle, improves circulation, lowers blood pressure, raises good cholesterol, and reduces inflammation throughout your body. Aerobic exercise, including walking, jogging, cycling, swimming, and dancing, provides the greatest cardiovascular benefits by strengthening your heart and improving its efficiency. Starting with low-intensity activities and gradually increasing duration and intensity allows your cardiovascular system to adapt safely. The target heart rate for cardiovascular benefits ranges from 50 to 85% of your maximum heart rate, calculated as 220 minus your age. Exercising within this range for at least 30 minutes most days of the week provides substantial coronary artery disease protection. Resistance training, including weightlifting, resistance band exercises, and bodyweight exercises, complements aerobic exercise by building muscle mass, increasing metabolism, and improving bone density. Muscle tissue burns more calories at rest than fat tissue, helping with weight management and blood sugar control. Flexibility and balance exercises, including yoga and tai chi, provide additional benefits by reducing stress, improving circulation, and enhancing overall physical function. These activities also help prevent falls and injuries that could interfere with regular exercise participation. High-intensity interval training, alternating between periods of intense exercise and recovery, can provide cardiovascular benefits in less time than traditional steady-state exercise. This approach may be particularly beneficial for people with busy schedules who struggle to find time for longer exercise sessions. Exercise prescription should be individualized based on current fitness level, health status, and personal preferences. People with existing cardiovascular disease or multiple risk factors should consult with their healthcare provider before beginning an exercise program. Overcoming barriers to exercise requires creativity and flexibility in finding activities that fit your schedule, preferences, and physical capabilities. Home exercise options, including exercise videos, bodyweight exercises, and resistance bands, eliminate the need for gym memberships or specialized equipment. Social support enhances exercise adherence, with group activities, exercise partners, and family involvement increasing the likelihood of maintaining regular physical activity. Community programs, walking groups, and fitness classes provide social interaction while promoting cardiovascular health. Technology can support exercise efforts through fitness trackers, smartphone apps, and online programs that provide motivation, track progress, and offer guidance. These tools can help individuals monitor their activity levels and gradually increase their exercise intensity and duration. ## Stress management and mental health. Chronic stress represents a significant but often overlooked risk factor for coronary artery disease, with the physiological effects of stress directly contributing to atherosclerosis and increasing the likelihood of heart attack. Understanding and managing stress effectively provides important protection against cardiovascular disease. The stress response triggers the release of hormones including cortisol and adrenaline, which raise blood pressure, increase heart rate, and promote inflammation throughout the body. When these responses occur repeatedly over time, they contribute to the development and progression of coronary artery disease. Acute stress can trigger heart attacks in people with existing coronary artery disease by causing blood vessels to constrict, increasing blood pressure, and promoting blood clot formation. Major life events, work stress, and relationship conflicts have all been associated with increased heart attack risk. Chronic stress also promotes unhealthy behaviors that increase coronary artery disease risk, including smoking, overeating, excessive alcohol consumption, and physical inactivity. People under chronic stress often neglect self-care activities that protect cardiovascular health. Stress management techniques provide powerful tools for reducing cardiovascular risk while improving overall quality of life. Deep breathing exercises, meditation, progressive muscle relaxation, and mindfulness practices all help activate the body's relaxation response and counteract the harmful effects of chronic stress. Regular physical activity serves as both a stress management tool and a cardiovascular protective factor, providing dual benefits for heart health. Exercise releases endorphins, improves mood, and provides a healthy outlet for stress and frustration. Social support networks provide crucial protection against both stress and cardiovascular disease, with strong relationships associated with better health outcomes and longer life expectancy. Investing in relationships with family, friends, and community members provides both emotional support and practical assistance during difficult times. Professional counseling or therapy can help individuals develop effective coping strategies for managing stress and addressing underlying mental health conditions that may contribute to cardiovascular risk. Depression and anxiety are both associated with increased coronary artery disease risk and worse outcomes in people with existing heart disease. Time management and organization skills help reduce stress by creating more predictable and manageable daily routines. Setting realistic goals, prioritizing tasks, and learning to say no to excessive commitments can help prevent stress overload. Sleep quality significantly affects stress levels and cardiovascular health, with poor sleep contributing to increased stress hormones, elevated blood pressure, and impaired immune function. Establishing regular sleep schedules and creating optimal sleep environments support both stress management and cardiovascular health. ## Sleep and cardiovascular health. Sleep quality and duration significantly influence cardiovascular health, with both insufficient sleep and poor sleep quality increasing coronary artery disease risk. Understanding the connection between sleep and heart health empowers you to make sleep a priority in your cardiovascular disease prevention strategy. Adults require 7 to 9 hours of quality sleep nightly for optimal cardiovascular health, with consistent sleep schedules being as important as sleep duration. Irregular sleep patterns disrupt circadian rhythms and contribute to metabolic dysfunction that increases coronary artery disease risk. Sleep deprivation increases stress hormones, raises blood pressure, promotes inflammation, and impairs glucose metabolism, all of which contribute to coronary artery disease development. People who consistently sleep less than 6 hours nightly face significantly higher cardiovascular disease risk. Sleep apnea, a condition where breathing repeatedly stops and starts during sleep, affects millions of Americans and dramatically increases coronary artery disease risk. The repeated oxygen deprivation and sleep disruption caused by sleep apnea stress the cardiovascular system and accelerate atherosclerosis. Symptoms of sleep apnea include loud snoring, gasping or choking during sleep, morning headaches, excessive daytime sleepiness, and difficulty concentrating. People with these symptoms should undergo sleep testing to diagnose and treat sleep apnea effectively. Treatment for sleep apnea typically involves continuous positive airway pressure therapy, which keeps airways open during sleep and prevents the oxygen deprivation that damages the cardiovascular system. Weight loss, positional therapy, and oral appliances may also be effective in some cases. Improving sleep quality requires attention to sleep hygiene practices, including maintaining consistent sleep schedules, creating optimal sleep environments, and avoiding stimulating activities before bedtime. The bedroom should be cool, dark, and quiet to promote restful sleep. Limiting caffeine intake, particularly in the afternoon and evening, helps prevent sleep disruption and improve sleep quality. Caffeine can remain in the system for 6 to 8 hours, potentially interfering with sleep even when consumed earlier in the day. Regular exercise improves sleep quality and duration, but exercising too close to bedtime can be stimulating and interfere with sleep. Completing vigorous exercise at least 3 hours before bedtime allows the body to wind down properly. Managing stress and anxiety through relaxation techniques, meditation, or professional counseling helps improve sleep quality and reduces the cardiovascular impact of chronic stress. Racing thoughts and worry can prevent both falling asleep and achieving restorative sleep stages. ## Regular health monitoring and screening. Regular health monitoring and screening provide essential early detection opportunities for coronary artery disease and its risk factors, enabling intervention before significant damage occurs. Understanding appropriate screening recommendations and maintaining regular healthcare relationships could save your life. Blood pressure monitoring should begin in young adulthood, with regular checks at least every 2 years for people with normal blood pressure and more frequent monitoring for those with elevated readings. Home blood pressure monitoring can provide valuable information about blood pressure patterns and treatment effectiveness. Cholesterol screening should begin by age 20 and continue every 4 to 6 years for people with normal levels, with more frequent testing for those with elevated cholesterol or other risk factors. Lipid panels measure total cholesterol, low-density lipoprotein cholesterol, high-density lipoprotein cholesterol, and triglycerides. Diabetes screening should begin by age 45 for all adults, with earlier screening for those with risk factors including obesity, family history, or previous gestational diabetes. Hemoglobin A1C, fasting glucose, and oral glucose tolerance tests can all detect diabetes and prediabetes. Body mass index calculation and waist circumference measurement help identify obesity and assess cardiovascular risk. These simple measurements can be performed at home and provide important information about metabolic health and cardiovascular risk. Electrocardiograms can detect heart rhythm abnormalities and evidence of previous heart attacks, providing baseline information for future comparison. While not routinely recommended for screening asymptomatic individuals, electrocardiograms may be appropriate for people with multiple risk factors. Stress testing, including exercise stress tests and pharmacological stress tests, can detect coronary artery disease in people with symptoms or multiple risk factors. These tests evaluate how the heart responds to increased demands and can identify areas of inadequate blood flow. Coronary artery calcium scoring uses computed tomography to measure calcium deposits in coronary arteries, providing information about atherosclerotic plaque burden. This test may be appropriate for people at intermediate risk for coronary artery disease to guide treatment decisions. Carotid ultrasound can detect atherosclerosis in the carotid arteries, which often parallels coronary artery disease. This non-invasive test may be appropriate for people with multiple risk factors to assess overall atherosclerotic burden. Ankle brachial index compares blood pressure in the arms and legs to detect peripheral artery disease, which often coexists with coronary artery disease. This simple test can be performed in a healthcare provider's office and provides information about overall cardiovascular health. C-reactive protein levels can indicate inflammation in the body, which contributes to atherosclerosis and coronary artery disease. Elevated levels may indicate increased cardiovascular risk and guide treatment decisions. #Understanding treatment options. When prevention efforts are insufficient or coronary artery disease has already developed, understanding treatment options empowers you to work effectively with your healthcare team to manage the condition and prevent complications. Treatment approaches range from lifestyle modifications and medications to invasive procedures and surgery. Lifestyle modifications remain the foundation of coronary artery disease treatment, with diet, exercise, stress management, and smoking cessation providing benefits even for people with advanced disease. These interventions can slow disease progression, improve symptoms, and reduce the risk of heart attack and death. Antiplatelet medications, including aspirin and clopidogrel, help prevent blood clots from forming in narrowed coronary arteries and reduce the risk of heart attack. These medications are typically prescribed for people with diagnosed coronary artery disease or those at high risk for cardiovascular events. Statins represent the most important class of medications for managing coronary artery disease, providing cholesterol-lowering effects and additional benefits including plaque stabilization and anti-inflammatory effects. These medications can significantly reduce the risk of heart attack, stroke, and cardiovascular death. Beta blockers slow heart rate and reduce blood pressure, decreasing the workload on the heart and improving symptoms of angina. These medications are particularly beneficial for people who have had heart attacks, as they reduce the risk of future cardiac events. Angiotensin-converting enzyme inhibitors and angiotensin receptor blockers help lower blood pressure and provide additional cardiovascular benefits, particularly for people with diabetes or heart failure. These medications can slow the progression of coronary artery disease and improve outcomes. Calcium channel blockers help relax blood vessels and reduce blood pressure, improving blood flow to the heart and reducing symptoms of angina. These medications are particularly useful for people with coronary artery spasm or those who cannot tolerate other medications. Nitroglycerin provides rapid relief from angina symptoms by dilating coronary arteries and reducing the workload on the heart. This medication can be taken as needed for symptom relief or used preventively before activities that typically trigger angina. Percutaneous coronary intervention, including balloon angioplasty and stent placement, can open blocked coronary arteries and restore blood flow to the heart muscle. These procedures are typically reserved for people with severe symptoms or high-risk coronary artery disease. Coronary artery bypass surgery creates new pathways for blood to reach the heart muscle by using vessels from other parts of the body to bypass blocked coronary arteries. This procedure is typically recommended for people with extensive coronary artery disease or those who are not candidates for percutaneous intervention. Cardiac rehabilitation programs provide structured exercise training, education, and support for people recovering from heart attacks or cardiac procedures. These programs significantly improve outcomes and help people safely return to normal activities. #Special considerations for different populations. Coronary artery disease affects different populations in unique ways, requiring tailored approaches to prevention, recognition, and treatment. Understanding these differences ensures that all Americans receive appropriate care and achieve optimal cardiovascular health outcomes. Women face unique challenges with coronary artery disease, including different symptom presentations, later onset of disease, and historically inadequate recognition of their cardiovascular risk. Women are more likely to experience atypical symptoms including fatigue, nausea, back pain, and jaw pain rather than classic chest pain. Hormonal factors significantly influence women's cardiovascular risk, with estrogen providing protective effects before menopause and increased risk after menopause. Pregnancy-related conditions including gestational diabetes and preeclampsia also increase long-term cardiovascular risk. Women often have smaller coronary arteries than men, which can complicate diagnosis and treatment. Imaging tests may be less sensitive in women, and interventional procedures may be more challenging due to smaller vessel size. Older adults face increased coronary artery disease risk due to age-related changes in blood vessels, longer exposure to risk factors, and higher prevalence of conditions like diabetes and hypertension. However, the benefits of prevention and treatment continue throughout the lifespan. Medication considerations in older adults include potential drug interactions, altered drug metabolism, and increased sensitivity to side effects. Lower starting doses and careful monitoring are often necessary to ensure safe and effective treatment. Exercise recommendations for older adults emphasize safety and gradual progression, with particular attention to balance and fall prevention. Resistance training becomes increasingly important with age to maintain muscle mass and bone density. Younger adults increasingly face coronary artery disease risk due to rising rates of obesity, diabetes, and sedentary lifestyles. Early intervention and prevention strategies are particularly important in this population to prevent premature cardiovascular events. Racial and ethnic minorities face disproportionate coronary artery disease burden due to genetic factors, higher prevalence of risk factors, and healthcare disparities. Culturally appropriate interventions and improved access to care are essential for addressing these disparities. African Americans have higher rates of hypertension, diabetes, and obesity, all of which increase coronary artery disease risk. Genetic factors may also contribute to increased cardiovascular risk in this population. Hispanic Americans face increased diabetes risk and often have cultural dietary patterns that may increase cardiovascular risk. Language barriers and cultural differences can also affect healthcare access and quality. Native Americans have some of the highest rates of diabetes and cardiovascular disease in the United States, with unique cultural and geographic factors affecting prevention and treatment efforts. #The role of healthcare providers. Healthcare providers play crucial roles in coronary artery disease prevention, detection, and treatment, serving as partners in your cardiovascular health journey. Understanding how to work effectively with your healthcare team maximizes the benefits of medical care and improves outcomes. Primary care physicians serve as the first line of defense against coronary artery disease, providing risk factor assessment, screening, and initial treatment for most patients. These physicians coordinate care with specialists and provide ongoing monitoring and support. Cardiologists specialize in the diagnosis and treatment of heart disease, including coronary artery disease. These specialists may be involved in complex cases, invasive procedures, and management of advanced disease. Cardiac surgeons perform coronary artery bypass surgery and other cardiac procedures for people with severe coronary artery disease. These specialists work closely with cardiologists and other healthcare providers to determine the best treatment approach. Nurse practitioners and physician assistants provide valuable cardiovascular care, including risk factor management, patient education, and follow-up care. These healthcare providers often have more time for patient education and counseling than physicians. Registered dietitians provide specialized nutrition counseling and education to help people implement heart-healthy dietary patterns. These professionals can create personalized meal plans and provide ongoing support for dietary changes. Exercise physiologists and cardiac rehabilitation specialists help people safely increase physical activity and recover from cardiac events. These professionals provide supervised exercise programs and education about safe exercise practices. Pharmacists play important roles in medication management, including ensuring appropriate drug selection, monitoring for drug interactions, and providing patient education about medications. These professionals can help optimize medication regimens and reduce side effects. Mental health professionals, including psychologists and social workers, provide important support for stress management, depression, and anxiety, all of which can affect cardiovascular health. These professionals can help people develop coping strategies and address mental health concerns. #Emergency recognition and response. Recognizing the signs of a heart attack and knowing how to respond appropriately can save lives and minimize heart damage. Every American should understand these critical signs and know what steps to take when someone experiences a cardiac emergency. Classic heart attack symptoms include chest pain or discomfort that feels like pressure, squeezing, fullness, or pain in the center of the chest lasting more than a few minutes or that goes away and comes back. This pain may spread to the arms, back, neck, jaw, or stomach. Additional heart attack symptoms include shortness of breath, which may occur with or without chest discomfort, nausea, vomiting, lightheadedness, or fainting. Women are more likely to experience these additional symptoms without classic chest pain. Some heart attacks present with sudden, severe symptoms, while others develop gradually with mild symptoms that worsen over time. Any chest discomfort or other symptoms that could indicate a heart attack should be taken seriously and evaluated promptly. The appropriate response to suspected heart attack symptoms is to call emergency medical services immediately by dialing 911. Emergency medical technicians can begin life-saving treatment during transport to the hospital and alert the emergency department to prepare for the patient's arrival. Aspirin can help during a heart attack by reducing blood clotting, but it should only be taken if the person is not allergic to aspirin and has no bleeding disorders. The recommended dose is 1 regular-strength aspirin chewed rather than swallowed to speed absorption. Time is critical during a heart attack, with every minute of delay increasing the amount of heart muscle that dies permanently. Emergency medical treatment can restore blood flow to the heart and minimize damage if provided quickly enough. Do not drive yourself or have someone else drive you to the hospital unless emergency medical services are unavailable. Ambulances carry equipment and medications that can be life-saving during transport and can alert the hospital to prepare for immediate treatment upon arrival. While waiting for emergency medical services, the person should sit down, rest, and try to remain calm. Loosening tight clothing around the neck and chest may help with breathing. If the person becomes unconscious and stops breathing normally, cardiopulmonary resuscitation should be started immediately. Automated external defibrillators are available in many public places and can restore normal heart rhythm in some cases of cardiac arrest. These devices provide voice instructions and are designed to be used by untrained individuals in emergency situations. ## The economic reality of coronary artery disease. The financial impact of coronary artery disease extends far beyond healthcare costs, affecting individuals, families, employers, and society as a whole. Understanding these economic realities emphasizes the importance of prevention and early intervention. Healthcare costs for coronary artery disease include emergency department visits, hospitalizations, diagnostic tests, medications, procedures, and ongoing follow-up care. A single heart attack can result in hospital bills exceeding $100,000, with additional costs for rehabilitation and long-term care. Lost productivity affects both individuals and employers, with coronary artery disease causing missed work days, reduced work capacity, and early retirement. The average person with coronary artery disease misses significantly more work days than healthy individuals and may be unable to perform physically demanding jobs. Disability costs include Social Security disability payments and reduced earning capacity for people unable to work due to coronary artery disease. These costs affect not only the individuals involved but also the social safety net programs that provide support. Family financial impact includes caregiving costs, lost income for family members who provide care, and emotional stress that can affect the entire family's well-being. Spouses and children of people with coronary artery disease often experience financial hardship and reduced quality of life. Insurance implications include higher premiums for people with coronary artery disease and potential limitations on coverage for certain treatments or procedures. People with pre-existing coronary artery disease may face challenges obtaining life insurance or disability insurance. Prevention represents the most cost-effective approach to managing coronary artery disease, with lifestyle modifications and risk factor management costing far less than treatment of established disease. Investing in prevention through healthy lifestyle choices provides enormous financial returns over time. Employer wellness programs can reduce coronary artery disease costs by promoting healthy behaviors, providing health screenings, and supporting employees in making lifestyle changes. These programs benefit both employers through reduced healthcare costs and employees through improved health outcomes. ## Technology and innovation in prevention and treatment. Advances in technology continue to improve our ability to prevent, detect, and treat coronary artery disease, offering new hope for reducing the burden of this deadly condition. Understanding these innovations helps patients and healthcare providers make informed decisions about care. Telemedicine and remote monitoring technologies enable healthcare providers to monitor patients with coronary artery disease from a distance, improving access to care and enabling early intervention when problems arise. These technologies are particularly valuable for people in rural areas or those with mobility limitations. Wearable devices including fitness trackers, smartwatches, and continuous glucose monitors provide real-time information about physical activity, heart rate, blood pressure, and blood sugar levels. This information helps individuals monitor their health and make informed decisions about lifestyle modifications. Mobile health applications provide tools for tracking diet, exercise, medications, and symptoms, helping people manage their cardiovascular risk factors more effectively. These applications can also provide education, motivation, and connection to healthcare providers. Artificial intelligence and machine learning are being applied to coronary artery disease prediction, diagnosis, and treatment planning, potentially improving outcomes and reducing costs. These technologies can analyze large amounts of data to identify patterns and make predictions about individual risk. Advanced imaging technologies including cardiac computed tomography, magnetic resonance imaging, and molecular imaging provide detailed information about coronary artery disease and help guide treatment decisions. These non-invasive tests can detect disease earlier and more accurately than traditional methods. Minimally invasive treatment options continue to evolve, with new stent designs, drug-eluting balloons, and percutaneous valve replacement procedures offering alternatives to traditional surgery. These procedures typically involve shorter recovery times and reduced complications compared to open surgery. Precision medicine approaches use genetic information, biomarkers, and other individual characteristics to tailor prevention and treatment strategies to specific patients. This personalized approach may improve outcomes while reducing side effects and costs. Regenerative medicine research explores the use of stem cells, gene therapy, and tissue engineering to repair damaged heart tissue and restore normal function. While still experimental, these approaches offer potential future treatments for advanced coronary artery disease. ## Community and policy approaches. Addressing the coronary artery disease epidemic requires community-wide and policy-level interventions that create environments supporting cardiovascular health. Individual behavior change alone is insufficient to address the scale of this public health challenge. Built environment modifications including sidewalks, bike paths, parks, and recreational facilities make physical activity more accessible and appealing to community members. These infrastructure improvements benefit entire communities and can significantly increase population-level physical activity. Food environment improvements including farmers' markets, community gardens, and policies restricting unhealthy food marketing can improve access to healthy foods and reduce exposure to foods that promote coronary artery disease. These changes are particularly important in low-income communities with limited access to healthy foods. Tobacco control policies including smoke-free laws, tobacco taxes, and restrictions on tobacco marketing have successfully reduced smoking rates and exposure to secondhand smoke. Continued efforts to denormalize tobacco use and support cessation efforts are essential for reducing coronary artery disease burden. Workplace wellness programs and policies can significantly impact employee health by promoting physical activity, providing healthy food options, supporting stress management, and offering health screenings. Employers have strong incentives to invest in employee health due to reduced healthcare costs and improved productivity. School-based interventions including physical education programs, healthy school meals, and health education can establish healthy behaviors early in life and reduce future coronary artery disease risk. Children who develop healthy habits are more likely to maintain them throughout their lives. Healthcare system improvements including better coordination of care, expanded access to preventive services, and integration of mental health services can improve outcomes for people at risk for or living with coronary artery disease. Payment system reforms that reward prevention rather than treatment of disease can align incentives with health outcomes. Public health campaigns and education efforts raise awareness about coronary artery disease risk factors and promote healthy behaviors. These campaigns are most effective when they are culturally appropriate, use multiple communication channels, and are sustained over time. Policy interventions including regulations on food labeling, trans fat bans, and sodium reduction initiatives can improve the nutritional quality of the food supply and reduce population-level cardiovascular risk. These policy changes can achieve widespread impact without requiring individual behavior change. #The future of coronary artery disease prevention. The future of coronary artery disease prevention holds tremendous promise, with emerging technologies, treatments, and approaches offering new opportunities to reduce the burden of this devastating condition. Understanding these developments helps individuals and healthcare providers prepare for and take advantage of new opportunities. Genetic testing and counseling may become routine parts of cardiovascular risk assessment, allowing for personalized prevention strategies based on individual genetic risk profiles. This information could guide decisions about lifestyle modifications, medications, and screening intervals. Advanced biomarkers beyond traditional cholesterol testing may provide more accurate risk prediction and guide treatment decisions. These biomarkers could identify people at high risk who would benefit from intensive prevention efforts before traditional risk factors become abnormal. Personalized nutrition approaches using genetic information, microbiome analysis, and metabolic profiling could provide individualized dietary recommendations that optimize cardiovascular health for each person. This precision nutrition approach may be more effective than one-size-fits-all dietary guidelines. Virtual reality and gamification technologies may make healthy behaviors more engaging and sustainable, particularly for younger generations. These technologies could provide immersive exercise experiences, interactive nutrition education, and motivation for behavior change. Nanotechnology applications in medicine may enable targeted drug delivery, early disease detection, and minimally invasive treatments for coronary artery disease. These microscopic technologies could revolutionize both prevention and treatment approaches. Artificial organs and tissue engineering may provide options for people with end-stage coronary artery disease who are not candidates for traditional treatments. While still experimental, these technologies offer hope for people with advanced disease. Population health management systems using big data and predictive analytics could identify high-risk individuals and communities, enabling targeted interventions and resource allocation. These systems could help prevent coronary artery disease on a population level. Gene therapy approaches may eventually be able to modify genetic risk factors for coronary artery disease, providing protection against atherosclerosis and its complications. While still in early research phases, these approaches represent the ultimate in personalized medicine. #Taking action, your next steps. Armed with this comprehensive understanding of coronary artery disease, you now have the knowledge necessary to take control of your cardiovascular health and protect yourself and your loved ones from this silent killer. The time for action is now, and every day you delay increases your risk. Begin with a comprehensive assessment of your current cardiovascular risk by evaluating your personal and family history, measuring your blood pressure and cholesterol levels, and calculating your body mass index. This baseline assessment will guide your prevention strategies and help you track progress over time. Schedule an appointment with your healthcare provider to discuss your cardiovascular risk and develop a personalized prevention plan. This plan should address all modifiable risk factors and include specific, measurable goals for lifestyle modifications and medical management. Implement dietary changes gradually but consistently, focusing on increasing fruits, vegetables, whole grains, and lean proteins while reducing sodium, saturated fats, and added sugars. Small changes made consistently over time are more sustainable than dramatic changes that are difficult to maintain. Establish a regular exercise routine that includes both aerobic activity and strength training, starting at your current fitness level and gradually increasing intensity and duration. Find activities you enjoy and can realistically maintain long-term rather than pursuing extreme exercise programs that are unsustainable. Develop effective stress management strategies including relaxation techniques, regular physical activity, adequate sleep, and strong social connections. Stress management is not a luxury but a necessity for cardiovascular health and overall well-being. If you smoke, quit immediately and seek professional help if needed. The cardiovascular benefits of smoking cessation begin within hours and continue to increase over time, making this the single most important step smokers can take for their health. Monitor your progress regularly through follow-up appointments with your healthcare provider, home monitoring of blood pressure and weight, and tracking of lifestyle modifications. Regular monitoring helps maintain motivation and allows for adjustments to your prevention plan as needed. Educate your family members about coronary artery disease prevention and encourage them to adopt heart-healthy behaviors. Family support improves success rates for behavior change and creates an environment that supports cardiovascular health for everyone. Stay informed about new developments in coronary artery disease prevention and treatment by maintaining regular contact with your healthcare provider and staying current with reputable health information sources. Medical knowledge continues to evolve, and new opportunities for prevention and treatment emerge regularly. Remember that preventing coronary artery disease is not just about avoiding a medical condition, it is about preserving your ability to live a full, active, and meaningful life. The investments you make in your cardiovascular health today will pay dividends in terms of quality of life, longevity, and freedom from the devastating effects of heart disease. The choice is yours, and the time is now. Coronary artery disease may be a silent killer, but you now have the knowledge and tools to defend yourself against this threat. Take action today to protect your heart, preserve your health, and secure your future. Your life and the lives of those who love you depend on the choices you make starting right now.